Pharmacology, VTNE, and final exam review. Opioids. Morphine is our first opioid. What happens to cats when given too fast? This is morphine mania. There is some literature where they're discussing the legitimacy of this, but we do avoid trying to give morphine too quickly, as any of, common sense would go. Major GI side effects are vomiting and constipation. So vomiting, this can make an animal feel nauseous, and then in the after effects, opioids can increase the chance of constipation. What happens if given too fast? Vomiting is very likely. Mania is a possibility. What happens to the respiratory system? It suppresses the respiratory center of the brain. So please keep in mind that this can have an effect on the quality and quantity of respirations. This is reversed with naloxone, also called Narcan. Butorphanol as well, Torbutrol, and buprenorphine, Buprenex. Butorphanol and buprenorphine are going to work in the agonist-antagonist system, and it can help with the mu and the kappa receptors and reversing some of the negative side effects that we could potentially see. And what schedule? This is a control schedule 2 opioid analgesic. Oxymorphone, also called new morphine. This is reversed with naloxone, also called Narcan. The schedule is control schedule 2. Greater potency than morphine and hydromorphone, which means it is a stronger drug that we can use less of the drug for similar effects. And expect fewer side effects, but expect this to last a longer duration. Hydromorphone, also called Dilaudid, is reversed with naloxone, also called Narcan. The schedule is control schedule 2. Routes, IV, IM, sub-Q, and we can give this epidurally. When we're administering this in an epidural, keep in mind that we want to use single-use vials. We don't want to use multi-use punctured vials for safety in case of contamination. Fentanyl, Duragesic, is reversed with naloxone, also called Narcan. The schedule is control schedule 2. The routes include IV. It can also be given as a constant rate infusion, intramuscular, subcutaneously, and transdermal. How long does it take to kick in as a transdermal patch? It can take 6 to 12 hours. Never put the transdermal patch on a heating pad. That will increase the absorption. And do not cut transdermal patches in half. We can leave half of the tape or the covering on the patch to administer only half, but we never cut these in half because it will get absorbed that much faster. How to dispose of it? We fold in half and we tape it together, and we place it in a cat litter or waste bin where we will make it less tempting to get into. This can be fatal for small pets and children as well, so we have to be extremely careful about how we dispose of the fentanyl. Also, please note that this is in micrograms. Micrograms, remember, we're going down the ladder into smaller units. So this is going to be a millionth of a gram or a thousandth of a milligram. So we have our grams, down 3 steps or 1,000 factor to milligrams, and then down 3 more steps or 3 factors to get to micrograms. So keep this in mind when you have to do calculations. How can you convert from micrograms to milligrams and micrograms to grams? Be very careful with that. Remember, small to big, if we go from micrograms to milligrams, we're going to divide. Silly babies dancing. And if we need to go from milligrams to micrograms, big to small is best soccer mom, and we multiply. Butorphanol, also called Torbugesic or Torbutrol. This is reversed with naloxone, also called Narcan. The schedule is control schedule 4. Duration is going to be 1 to 2 hours at most. Some studies say 20 minutes in some patients. And the drug that it partially reverses is morphine. This is called a partial agonist. Buprenorphine, also called Buprenex, is reversed with naloxone, Narcan. The schedule is control schedule 3. So I always think longer name, buprenorphine, stronger schedule. Then look at butorphanol, shorter name, lighter schedule. And it agonizes. What does it agonize? What does it antagonize? It stimulates the mu receptors, it agonizes them, and it will antagonize the kappa receptors. How long does it last? 8 to 12 hours. 72 hours is a slow release compounded formula. So this does have to come from compounding formula or specialty pharmacy in order to have the sustained release or the slow release. The routes are going to be IV, IM, PO, epidurally, and transmucosally in cats. This works really well when squirted on the gums, not down the throat. Tramadol, also called Ultram, is reversed with naloxone, Narcan, yohimbine, and yobine. The schedule is going to be control schedule 4. It cannot be split. This is an unscored tablet, and unscored tablets are not guaranteed to be able to be split in half. The reversals for our opioids include naloxone, Narcan. In some cases, yohimbine can also reverse, such as tramadol, which is a synthetic opioid. Naloxone, Narcan, this will reverse our opioids, and this can be used intravenously, intramuscularly, sub-Q, and intranasally.